Last fiscal year, the federal government reported that there was $94 billion in financial fraud around the Medicare program, around two programs, the Medicare and Medicaid programs. And just this week alone, actually, there was another group of Medicare fraud arrest, and 455 people, including some doctors, were arrested. So this is becoming really big. And don't get me wrong, it's not the fraud number that should be shocking. It is that this is the part that the government can measure and has been able to find. So they're doing much better at using AI and technology to root out these frauds. But what I want to talk with you about is how in your healthcare organization, can you make sure that you're not caught up in this, and how you can use AI technologies to help your organization work a little more efficiently. But also, there's a second piece of this. You don't want to miss the second half of this email, because it could be one of those things that as new technologies come about, you don't want to make sure that you're doing something and put you in jail inadvertently. So why now? CMS is publicly shifting its posture from what it had called to pay and chase on claims to now it is going into a detect and deploy of these technologies to be able to go after and look for people that are committing fraud. What I'm guessing is somebody who's openly committing fraud, probably not watching my YouTube channel. What you want to do is not look like a fraudster. So the best thing here to make sure your payments are not getting caught up is make sure you're doing things properly. You are documenting. I'm not a big fan of paper processes. I like to make sure if they are on paper that you have them scanned into an EHR, that they then convert from electric to digital and have a good audit trail. These documents, when you are seeing patients, you want to make sure that you have got empirical data showing that yes, you saw that person, this is what was done, and that it's backable in a court of law. Because what is coming about now is these algorithms are able to look and go, that office is 1,000 square feet. They're reporting that they're seeing the amount of patients that would be seen in a 10,000 square foot office. And we pulled up the Google Maps and see that there's not enough parking spots. So the research is now being able to be done from 1,000 miles away by AI, by systems, and go, here are the 10 people we need to be looking at and start doing fraud investigation on. So now the market, the Agentic AI, is aimed specifically at the detection and, as they were saying, prevention. So the detection is going to be what you have already done. The prevention is how you're operating that could fall into those guidelines. Billions of dollars, one of the cases we were looking at was $5 billion from back in 2024, which seems like forever ago in technology space. But 40% of the claims that were submitted by this organization had gotten flagged. That is because if there were minor errors. That is going to make that organization, if they do that in 26, look more fraudulent. So that is where using Agentic AI to proof the forms, proof the documents, have it do a QA/QC type of check before they're being submitted up the food chain, it's going to make your organization look a lot more buttoned up. It's going to make you look less like you're on the other side of the fraud. The other thing is, in the healthcare industry, it's an industry where we're used to there being the bottlenecks. If you're doing things proper, and you're doing things compliant, and you're doing things that are being, a high level of validity, it's going to make sure that your documents are flowing through the pipelines faster than somebody else. So somebody is going to be able to have those systems cleared electronically now, because the payers also, which is in case of Medicare and Medicaid, that's CMS, and they're putting in these systems that are able to look and validate. You want to make sure you're going to be able to be validated when you're pushing them over in it. And the other piece of this is going to make sure that when you do submit them, that you've got the right tracking and correlation. That means correlation is where we can take an incident, take an invoice, and go back through the chain to get all of the elements to give us that correlation via the EHR, the patient scheduling, all of those elements to make sure that if there is a question, you're able to answer that question quickly. The speed to resolution is one of those things that helps drive revenue recognition a little quicker. It also makes your organization look a little more reputable in the eyes of a human, or in this case, a digital bot, that is giving you a score. Let's not kid ourselves. I write algorithms, and what we're going to do is we're going to have every payer that is going to be out there, or every partner, we're going to put a score on them, and we're going to know this person normally delivers 92% accuracy. This one delivers 98%. This person down here is 14%. We're seeing abnormalities. They go to the top of the list to be looked at. The winners in this category are whoever has the smartest model, whoever earns the most payer trust and lets the model act and reward you. So it's not a hard step to take. It's something I think you should be looking at. And if you want to talk more about this, feel free to book a free consultation call. We talk with healthcare companies and AI, agentic workflows all the time. So get us on sales@wt.net or hit me up on LinkedIn.